Hello and welcome again to this part of the course where we will discuss the adductors and extensors of the shoulder. To perform these movements, we have to be in a flexed abducted position and then return. The muscles that perform these movements are the posterior deltoid, latissimus dorsi, teres major, long head of triceps brachii, and the sternocostal head of the pectoralis major. This action is important in tasks such as pulling the arm against resistance when climbing a rope or propelling through water. In both of these examples, you perform flexion and abduction first, and then pull into extension and abduction. So we agree that pulling in general requires extension and adduction of the shoulder. One of the most important concepts to consider when performing these actions is that most of the muscles mentioned earlier are attached to the scapula. To illustrate this concept, let's apply the idea to the teres major muscle. As you can see, the muscle is attached to both the scapula and humerus. Remember previously when we discussed how muscles contract? Muscles always shorten from both sides. So in this case, since the muscle is attached to both the scapula and humerus, it should bring them closer to each other. But what you want is to perform only the movement of the humerus to bring it back into an anatomical position and extend and adduct the humerus once again. So in order to prevent the scapula laterally, a muscle that medially pulls the scapula to stabilize it must come into play to help maintain the position of the scapula and prevent excessive lateral movement. This muscle is the rhomboids muscle, which acts as a retractor to prevent the protraction of the scapula during the activation of these muscles. Okay, we've talked about bringing the arm back into an anatomical position from a flexed abduct arm into an extended adducted arm. But the extension here was back to neutral. What about hyperextending the shoulder, bringing the arm backward? In order to perform this action to the maximum, the scapula should anteriorly tilt to maximize this movement as shown in the illustration. The muscle responsible for this action is the pectoralis minor. So when hyperextending the arm, the pectoralis minor comes into play to maximize the backward reach of the arm. One last note on this topic is that during shoulder adduction and extension, the rotator cuff muscles have to contract. They all share the medial pull on the humerus and help stabilizing the humerus by compressing it medially towards the glenoid. So they have to contract to help stabilize the head during its motion. And that's it for this part. See you in the next one.